For more on the coronavirus, I want to bring in Dr. Eric Cioe-Pena. He's the Director of Global Health for Northwell Health and joins me now from Staten Island, New York. Doctor, welcome. Great to have you with us. So is there any medical evidence to suggest that schools should be shut down before indoor restaurants, bars, or gyms anywhere in the country?
So certainly there's evidence that in the age groups of 9 to kind of college age that the viral transmission rates are that of adults or perhaps a little bit more. So there's definitely, I think, good evidence for children above the age of 9 that would play a major role. And unfortunately, we don't as the numbers community wide go higher, we don't really want to find out how much of a role it'll play in other age groups. We've seen some countries where the schools were the main driver of infection, and then we've seen other places where it didn't seem to play a role at all. And the problem is we won't really know until we're looking at the data retrospectively.
Although it's so interesting to see the data, at least coming out of New York City, shows such a low infection rate within the schools. Our Tony DeCopel pressed New York City Mayor Bill de Blasio as to why the city settled on that 3% threshold, not within the schools again, but citywide, when that threshold isn't consistent with other states or the World Health Organization. Let's listen to how he responded.
Because we were the epicenter of this crisis, everyone knows that. We needed to bring our schools back in the fall, and we needed to show parents and staff that they'd be safe, so we set a very stringent standard and a whole lot of other health and safety standards, the distancing, the face masks for everyone, kids and adults alike, and we proved that schools would be safe. But we said if that rate went up higher, we were going to stop, we were going to pause and reset. Our schools are going to come back, but they're going to come back with additional safety standards.
So, Doctor, is there scientific basis for this 3% threshold, to automatically shut down schools? Is that a number that the city sort of came up with on its own, or that New York State came up with on its own, or is that used more widely?
No, I think I think they admitted that this was a standard that they were kind of setting themselves as an early warning sign of things heading in the wrong direction, and to allow themselves a pause and some breathing room to kind of reassess the safety situation. I don't think it really is correlated scientifically with anything in terms of community spread within schools or putting schools at additional risk. It was just a very strict bar, which they set out when they were negotiating with teachers and everyone else when they would kind of close the schools again. And so they're living up to their own standard, which is good. But I do not think that there's a public health kind of reason that 3% was chosen, other than it was a sign that things were taking a turn for the worse.
Right. And a CDC report shows that mental health-related ER visits are skyrocketing for children when compared to last year. Are there long-term physical and mental health risks from shutting down schools?
Oh, I think 100%. I think this is not a decision that should be taken lightly. I don't think anyone is taking it lightly, but the kids, especially children under 9, are much more likely to suffer because of the secondary causes of this virus and the shutdown than they are the virus. We know that for a fact. We know that worldwide. And so this is something that shouldn't be taken lightly, but I don't think anyone is. I think the other thing we worry about is not necessarily the direct viral kind of sequelae from the kids, but their ability to transmit it to older family members and spread it around their families. And so this is obviously something that has a lot of factors to weigh in, and we need to consider the welfare of children as we're doing this complicated math to how to open safely.
Absolutely. And where does the research stand on how widely the virus is spread from asymptomatic children, for instance, to adults?
So again, it's broken down into two different types of children. There's children under 9, which have an exquisitely low attack rate for the virus. They don't get infected nearly as much as older school-age children. And then the children 9 to 18 and then the 18 to 25s are essentially the same as adults or a little bit worse. And so, there's this kind of idea that early ages children really are not the mechanism of this or the driver of this pandemic. But again, there's been kind of regional variations. The studies out of India have shown much more of a role in schools than the studies in Europe. And so it's hard to interpret the data and apply it all to New York City. We're a very kind of uniquely situated environment. And so I think everyone's kind of nervous about that and wondering where it's going to break and kind of how it would play out if we kept schools open during COVID. But we are taking extraordinary safety precautions, and there is a huge value to in-person schooling.
Right. And doctor, we've been talking about New York, where the infection rate is still only at 3%, but many states in the upper Midwest are seeing positivity rates shoot up. I'd like to specifically look at South Dakota. That state has a 7-day rolling average of nearly 56%. In the past week, it has 161 positives per 100,000 residents. That is second only to North Dakota. By comparison, New York is just 24 per 100,000. And the governor there, Kristi Noem, refuses to implement a mask mandate, as we heard in Carter's piece earlier. How concerned are you about the spread in the upper Midwest, particularly in states that continue to not impose any sort of stringent health guidelines?
Yeah, I'm very concerned, and I think if you were a resident of that state, you should be demanding your government to work for you. I mean, this is not about personal liberty. This is not about telling people how to live their lives. This is about allowing people to live free of the risk of infection. No one is saying shut down the economy. No one is saying don't go to the supermarket. We want to reduce your risk while you're doing the things that you love. And if we had all taken this seriously, 4 weeks ago, and really gotten serious, we would have seen falling rates, not rising rates, and we might have been able to save Thanksgiving. But the problem is that we want to have closing our eyes and pretending everything's normal is not the same as doing the hard work to get things and infection rates back to a level where we can resume normal life. It's just not the same.
Right. And the reality is the country is now at 250,000 deaths to this virus, an incredible number. Dr. Eric Cioe-Pena, thank you so much for joining us.
Thanks for having me.